to everyone. My name is Canan Karadas, and I'm from Turkey and Hacettepe University. And this is my first international conference, so I'm a bit excited. And I apologize from the beginning if I had two mistakes of the speech. The title of my speech, The Effect of Range of Motion Exercises on Delirium Prevention among Patients aged 65 and over in intensive care units. And why delirium is a problem? Because elderly population increased survival rate after critical illness, advances medicine in technology, and better conditions of intensive care. After surviving after critical illness does not mean that everything is all right with the patients. So all these factors becomes the problem, the delirium problem, and other complications as well due to ICUs. And what is delirium? It's an acute state of confusion and a severe geriatric syndrome, common among older populations and common in intensive care units, and caused by a decrease in functional, metabolic, and cognitive activities. And it usually develops within 1 or 2 days and cause worsening of the patient's prognosis. Why are the elderly at risk for delirium development? Because they have decreased metabolic function, deteriorations of heart muscle and vascular structure, observed decline in basic cognitive functions such as attention, perception, or memory, and cognitive disorders such as dementia or depression, and polypharmacy as well. And the management and treatment of delirium is more difficult than the younger population. And according to the literature, diagnoses of delirium are overlooked 75% without using a valid and reliable screening tool. And more than 30 tools are used for screening delirium in 20 different countries and languages. And I said once a day, one life, because the guideline of British National Institute Healthcare and Excellence, the NICE guideline emphasized that in terms of delirium, patients should be evaluated at least once a day. And in Turkey, in Hacettepe University, we assess the patients in terms of delirium 3 times a day in every shift. And realize and change. Although delirium screening is important, it does not ensure an improvement in health outcomes. So after diagnosis, the etiology of delirium must be determined and the reason must be solved. And knowing risk factor is one of the most important steps. And when we look at the reasons of delirium, predisposing factors and precipitating factors, but most of the time it causes by their complex interaction. And predisposing factors indeed maintain the identifications of patients who are vulnerable, and they cannot change. Age, male sex, presence of severe dissociation, dementia, visual auditory disorders, depression, and kidney failure examples for it. And precipitating factors can be modified, and dehydratations, immobility, physical restraint, anemia, infection, and iatrogenic reasons are the precipitating risk factors. And this is the common acronym for delirium etiology. I watched that. Infections, withdrawals, acute metabolic disorders, trauma, central nervous system pathologies, hypoxia, deficiencies, endocrinopathies, acute vascular events, and toxins and heavy metal cause delirium. What we can do non-pharmacological intervention as a nurse, because we do the non-pharmacological approach independently and easily, and prevent malnutrition, reducing noise level in ICUs, reorientations patients every day and every shift, ensuring hearing and vision devices, providing pain control, prevention pressure ulcers, ensuring sleeping hygiene, and prevention from dehydration and constipations, and mobility is one of the important ones. Mobilization in ICU, I would explain the room exercises So one of the independent nursing interventions which allowing mobilization in ICU is range of motion exercises. These movements can help patients joint flexibility and reduce pain and improve the balance and sit range. And range of motion exercises also help for avoiding complications of immobility and encourage patients to move. And after especially the patient if they heart attack or cerebrovascular events. And positive effects of range of motion exercises improving the venous return and strong volume, increasing the amount of oxygen distributed to tissues, reducing ventilation time, and enhancing cognitive abilities. The effect of range of motion, and this is the my master degree thesis, and my academic advisor and I did it, and we are published online, and I guess next week we will publish in printed. So I want to explain our study also. And the purpose of our study to determine the effect of range of motion exercises on preventing delirium and shortening duration of delirium among patients in ICUs. In elderly patients. And flow chart is we used power analysis for determine the sample size. And these are the right one are excluded factors, and if the patient has younger than 65, we exclude them, and also if they had invasive mechanical ventilations, they are excluded again, and having delirium before the procedure, and amputated extremity, and active gastrointestinal bleeding, and having cognitive disabilities. These patients are excluded, and 3 patients refused to participate in the study. And the patients include the study. We divided them into 2 groups, control and interventions. For the control group, we assess daily CAM-ICU assessment, RAS assessments for the sedation level, and the routine clinical procedures. For intervention group, daily CAM-ICU, RAS, and the routine clinical procedures, and performing ROM exercises. A stratified randomization was used. We used blood urine nitrogen and serum creatinine ratio, Apache 2 scores, and the existence of visual impairments. The first patient was assigned to the intervention group, and the subsequent similar patient was matched in the control group. And data collect tool, I don't read everything, but we use data form, and it's developed by the researchers based on the previous literature. The CAM-ICU scale says that patients have delirium or not, and the RAS scale, we used it for delirium assessment, because if the RAS score lower than 3, the patients cannot assess in terms of delirium. ROM exercises for extremities. For upper extremities, we did the movements from shoulders to fingers, and for lower extremities, from hip to toes. And exercises were performed once a day until the patients were discharged from ICU. And assisted active or active ROM exercises were performed based on the patient's ability to respond verbal commands. And ROM exercises were performed in 4 extremity in supine positions, and with 10 repetitions, and it takes approximately 30 minutes for each patient. And then when some patients cannot tolerate the exercise, and these are the parameters of it. Mean arterial blood pressures little than 65, I can remember it, and systolic blood pressures more than 200, and pulse rate little than 40 or higher than 130, and saturation level less than 88%, and breathing rate less than 5 or higher than 40 per minute. And if the patient has arrhythmia, the exercise was stopped. And data analysis, we used IBM's SPSS Statistics 22 program, percentage, means, and medians for descriptive characters for the patients. And key score was assessed delirium incidence and visual impairment homogeneity. The Mann-Whitney test was used to assess the delirium duration, and independent sample t-test was used to assess blood urine nitrogen and creatinine ratio, and the Apache scores was used to assess homogeneity. Ethical consideration, the study was approved by the Ethical Committee of Turgut Özal University, and the researchers explained the study to the participants and their proxy decision maker prior to the study. Informed consent was obtained from the patients or their proxy decision makers. And results, during this study, 4 patients from the intervention group and 10 patients from the control group experienced delirium. And when we look at the delirium duration, in the intervention group it was shorter, and however there was no significant differences between groups in terms of delirium duration. And limitations, our study, the patients with just non-invasive mechanical ventilation. We excluded the invasive mechanical ventilations patients, and we just study with the medical ICUs, not surgical ICUs. And the small sample size is one of the another limitations of our study. And conflict of interest, researchers conflict I can't remember. The authors have no financial disclosures to declare and no conflicts of interest to report. And conclusions of our study, although a decrease of experimentally 2.5-fold was observed in delirium development and duration, there was no significant, statistically significant differences, but however, we found it clinically important. And the effect of range of motion exercises on delirium development and duration was limited in critically ill patients. And instead of offering only one type of mobility choice and individualized exercise therapy from passive room exercise to active mobility could be more promising for preventing delirium development and shortening the duration of delirium. And as a conclusion of my speech, mobilization is one of the most important positive health outcomes in ICUs. It can be varied from passive room exercises to walking in the unit. And when patient is admitted to the ICU, mobilization must start within 48 hours. And also the patients must evaluate in terms of delirium within 24 hours, at least once a day. Thank you.
I have a question. First of all, congratulations. Very well done. Very nice study.
Thank you.
You mentioned that there were 2 or 3-fold decrease in the development of delirium. Do you think if you had more patients enrolled in the study, you might have been able to achieve a statistical significance?
Yes, when I speak with my statistical analyzer, he said that if you have larger sample size, then maybe you can reach the statistically significant.
So my advice will be to do a power analysis, just try to figure out how many patients will be needed to have a statistical significance, and if the number is not that much different, or it still can be done, my request would be to continue the study and finish it and publish it. It's an excellent thing.
We finished the study because it's a master degree thesis. So if we don't finish it, then it means that master degree cannot finish.
Oh, all right.
So that's the reason. This is our another limitation also. Okay.